have a specific set of protocols they must follow in order to operate. Parks and golf courses will remain open. Citizens using those city parks are required to adhere to social distancing requirements, as we've done the last few weeks. The Governor Lee, has preempted local decisions regarding places of worship. Therefore, places of worship should follow the regulations issued by the Governor, and we believe that this afternoon he will supplement his order to explain his regulations or any restrictions regarding places of worship. Locally, we are working with faith leaders to guide them with some best practices. That being said, and I'm talking directly to our faith leaders right now, please continue to offer virtual in addition to any in-person services. I know this is difficult, and I know that you want all your members in your facility, but please offer virtual services on a continuing basis. With that, I'll hand it over to Dr. John McCullers to talk about entering into phase 1 this Monday.
Well, thank you very much, Mayor Strickland. Let me just start by saying that I'm very pleased to have been able to serve the city and the county in this way and to be providing some medical advice. And I've really been pleased how all of the mayors have been very interested in this being data-driven decisions, really taking the advice of the medical experts who are available to them and making decisions based on that. So I think if we look over our experience in the last 4 to 6 weeks as we've gone through Safer at Home and we've begun to try to control the COVID pandemic, what we've seen, I believe, is a couple of trends that have been followed. The first is we've been looking very carefully at the rate of new cases that we've seen every day. This is one of the key indicators that's been talked about across the country about how are we responding to the pandemic. Starting about a week after the Safer at Home order went into place, we've really seen a stabilization of that rate of new cases. Some days we have a little bit more cases, particularly if we do a lot more testing. Some days, perhaps if the weather was bad and we don't have as much community testing, we see a few less cases. But on average, over the last 3 to 4 weeks, we've been seeing 65 to 70 cases a day pretty regularly, and we have not seen an increase in that rate since the Safer at Home order went into place. The second trend we've been looking at really is hospitalizations for patients with COVID and the trends in utilization of intensive care beds and ventilators. And again, the early weeks of April, shortly after the Safer at Home order had gone into place and probably reflecting patients who were infected the week or so before the Safer at Home order went into place, we had a good number of cases in the hospital, many of them in intensive care, many of them requiring mechanical ventilatory support. Those numbers have dropped off the last several weeks, again, I think as a reflection of the impact of the Safer at Home order and the decreased number of cases overall that we were seeing. So right now we have a steady number of cases in the hospital every day. It fluctuates from day to day as you might expect, but we're not seeing a rapid increase or decline, really just a stability over the last 2 to 3 weeks. So the trends have been very comforting that the Safer at Home order has done what it intended to do, which was to slow or stop transmission of this virus. And we feel that we're at a good place right now in terms of the stability of the trend of new cases and the stability of the trend in terms of hospitalizations. So as a group, we've begun to look at the issue of when is it safe to open up, and as you know, the mayors made the decision yesterday that we would plan to open up on Monday, May 4th for phase 1 of the back to business. So what have been the things that we've used to really inform us about when that was appropriate and that we're going to use to follow and monitor our progress? And really, I like to talk about 3 different areas where we have to have good capacity in order to manage this pandemic and to keep good capacity as we start to open up and slowly phase in opening of businesses and other places. The first is the capacity in the hospital. As I said, I think capacity is very good right now. We have a reasonable number of cases in the hospital. It's a controllable number. We have open beds. We have open intensive care beds. It'll be very important to follow that capacity as we start to open elective surgeries. We have a little bit more business as usual within the hospitals as they start to see more cases, and monitor, do we still have room for more COVID patients if we have a surge? That's the first thing that we really want to keep a close eye on. The second is our capacity for testing. This has been steadily increasing over the last month. Perhaps 2 weeks ago, I would have told you I don't feel comfortable with the amount of testing we have out in the community. Right now, I feel like we're fairly comfortable with what we have. We can do about 1,000 tests a day out in the community, and we have a very broad reach out into many areas of the county, including into underserved communities. We're not done expanding our testing. I think we both need to expand the number of tests as well as the breadth of tests and be able to respond when we do see hot spots. But for today, I feel very comfortable. The level of testing is appropriate for what we need on the ground today as we move into this reopening. And the third area of capacity really is our public health response, which is being led by the Health Department and Dr. Elisa Haushalter. And that is around the ability to take every positive test we see, to do case tracing, case management, to understand the context of that case, and to do the general work of isolation, quarantine, and monitoring. And the Health Department has indicated that at least at this moment in time, we're comfortable with where we are. So the general gestalt that we've seen over the last couple of weeks is we have a stability in the situation with the pandemic. It is currently under some degree of control, under safer at home, and now we want to start to very carefully phase in opening some businesses, allowing some more social contact than we've been having, and see if we can continue to have that good capacity stay where it is, or at least keep it within a manageable range. That's what we'll be doing. We'll be watching this on a daily basis, monitoring those areas of capacity, and then reporting back the trends as they occur. So we're going into a bit of an experiment, I would say, but I think it's one that the health officials, the medical doctors here feel comfortable about, that we are monitoring the right things, and that our elected officials are listening to the medical experts and are trying to take really a data-driven approach. So with that, I'm going to ask Dr. Haushalter to come up and follow me and add to the comments. Dr. Haushalter.
Thank you, Dr. McCullers, and thank you, Mayor Strickland, as well. I also want to thank each and every one of you who has done your part to make sure we're able to go back to business on Monday. As has been noted, social distancing has worked, and it's worked because each of you have done what you can to reduce the transmission of COVID-19 in our community. One of the key responsibilities of public health is to share data so that we do have a data-driven approach. So we will continue to provide data and updates as we have thus far, and that will help in guiding further success, or if we have any increases or resurgence in illness, we'll be able to detect that quickly and take appropriate action. So today I'll give a few updates on the data and then end with some key next steps for us, and then open it up for questions. So as of today, we have 2,556 cases. That's an increase of 153 cases since Wednesday. But what's important there is while our numbers are continuing to go up, the rate that they're going up is decreasing, and that's because of decreased transmission. We've had 50 deaths thus far, and the average age of individuals who have succumbed to COVID is 73. I'll reinforce the need to protect our most vulnerable populations, particularly our seniors, but the majority of individuals, 98%, are doing quite well. Those who have recovered, we now have over 50%, 52% exactly, who have recovered, which is a very positive sign. Those who have contracted COVID are doing well, with the exception of a small group of individuals. Another key area is testing, which was mentioned earlier, and to date, we've tested almost 30,000 people in Shelby County. That's a significant number, and of those, 8.7% have been positive. If you recall, we've typically said our positivity rate was over 9 and closer to 10. That number is going down, which is also a good sign that it's time to get back to business. Over 90% of our tests have been negative. And then I also want to end with a few comments about moving forward. The primary responsibility of the health department is multifold, but one of those is to continue to provide data, and we will do that on a daily basis so that elected officials and others have data to make sound decisions. We also will continue to support testing, and one of the things we will do is look at expanding testing within the health department. So far, we have opted not to do testing with the exception of clusters, but we will add testing to our clinics in the upcoming months. In addition to that, we will continue contact tracing and cluster management specifically and continue to partner to get the word out and do good communications. For one of the key things that we would ask each of you to do is continue all of the efforts that you have regarding social distancing. So as we go back to business, it's really important that you continue to wear your facial coverings, covering both your nose and your mouth, that you continue to wash your hands very regularly for at least 20 seconds or more, that you continue to stay home if you're ill, and as you go back to the workplace, if you have to go back to the workplace, then definitely to try to social distance. If you can continue to work at home, then we really encourage people to work at home as well. The other is that we want to continue to encourage people to get tested. We have plenty of capacity, and individuals are not necessarily availing themselves of that capacity. So if anyone has symptoms of COVID, even very mild symptoms, whether it's muscle aches and pains, a slight cough, early signs of flu-like illness, we encourage you to get tested at one of the community sites. And next week we will be having some new sites come on board, and I wanted to identify those. We will have a site beginning in Bartlett next week at Freeman Park. We'll also have a site at the Agri Center beginning next week. The Kroger will be working with Cherokee Health, and they will be doing a site at the University of Memphis near the Holiday Inn. And then Christ Community will be expanding to both Orange Mound and to their Broad facility. So again, we encourage you to get tested, and at that, I will open it up for questions.
Sam Hardiman with the Commercial Appeal.
Hi, I have two questions. One is, the first is for Dr. McCullers and Dr. Haushalter. When we enter phase one next week, other health experts believe that we're going to see a spike in cases. And first, do you agree with that? And how much of a spike in terms of transmission number, et cetera, will you be comfortable with?
So it's possible that we will have a spike in cases. There's several things that are happening. One, again, people will be going back to business, but also we're doing expanded testing, and we're doing some asymptomatic testing so we can pick up cases that way as well. We will monitor the data daily. In fact, we actually monitor it several times daily. We also look at where we have clusters and put that in context. And so if we begin to see a resurgence that is exponential growth, or if we see that replication rate, which we've talked about significantly, goes up, that will be a reason for us to take pause, step back, consult with each other. We've had a very collaborative approach thus far, and make some sound decisions based on the information at hand. But it's not one single number. It's a combination of things that we use to make a final decision. And then I'll turn it over to Dr. McCullers for comment.
Yeah, I would just agree with Dr. Haushalter and add that we would hope that we're not going to see a spike in cases. I might expect as we start to have some increased social interactions, again in groups less than 10 and with careful social distancing within the businesses that are going to open, that perhaps we will see a trend towards some, a higher rate of daily cases. But I would hope that we would not be seeing a spike, which would mean this is really getting out of our control. The one area that I would say that I would remain concerned about was mentioned by Mayor Strickland, and that is in places of worship, that we continue to practice good social distancing as we start to go back into our churches and synagogues and other places of worship, because that's where we could see a spike if we had a large congregation come together who were not social distancing appropriately. That could lead to a serious cluster of cases and a spike in what we're experiencing.
Brad Broders with Local Memphis 24.
Hi, everyone. One question. We're seeing this morning that Germantown and other suburban businesses here at nail salons are saying that they are going to be beginning close contact at hair and nail salons beginning Wednesday, May 6th. If anyone can answer, I'd like to get your response and comment of whether they would be allowed to do that, and maybe just is there a sign of splintering on the timeline of phase one? And I have a follow-up after that.
Well, I cannot speak for the suburban cities at all, but I do want to kind of put all this in context. Just a few days ago, Monday, when all the mayors were standing here, we issued our our back to business plan. We had the nail salons and the hair salons and barbershops in phase two. At that time, the governor also had those establishments in his phase two. Since Monday, I don't know exactly what day, the governor amended his plan and said that those establishments can open May 6th, sometime during phase one. That has raised the level of interest in Shelby County with respect to that, and I know that some my fellow mayors have talked about that issue. I don't know what they've decided. I'm going to rely on the doctors to advise Memphis with respect to those establishments. Originally, they said that it should be in phase two. I was going to broach that subject with them again. I have not done that yet. I was going to do it over the next day or so, and then try to follow their guidance. He said he had a part two, I think.
I do. Thank you all. Mayor Strickland, could you kind of elaborate a little bit on, I know you had talked about code enforcement a little earlier this week about some of them are spending half their time on compliance. How do you anticipate sort of maybe the honor system, but also how do you anticipate code enforcement going out and just making sure the phase one businesses are complying with the capacity and other rules?
For the most part, in the last month or so, we've responded to complaints. When people call 311 or the police department, we've sent out code enforcement officers and police. The health department also has an enforcement arm, and I'll let Dr. Haushalter talk about that. But for the most part, the city has responded to complaints. I think we've done some proactive reviews to make sure businesses are complying, but it's mostly through complaints, and we will continue to do that. We will continue to monitor 311 and the police department. I think we've called on over 400 businesses under the Safer at Home order, and we found that the vast majority of them, once the situation is explained, the importance of social distancing and the order, they have complied. And I suspect as we go forward that the businesses will also agree to be compliant once the rules are explained. In addition to that, I forgot one group, we also have courtesy crews in all our parks who are not issuing citations or anything, but they're just explaining to the folks in our parks trying to enjoy the great weather that we've had that they need to abide by the social distancing, and to date they've done that. And I'll have Dr. Haushalter explain.
Thank you. I'll just make a few comments about the complementary role of the health department. Everyone knows that we do restaurant inspections, we do other facilities inspections, we do vector control and other services that require inspection as well as feedback. We have been able to utilize those staff to help support the Safer at Home, Stay at Home orders, and we look to expand that staff. Our approach is very similar to as outlined by Mayor Strickland, which is to provide education and outreach rather than have a heavy-handed approach. And then also our health officer and those that he designates have the ability to take further action based on our health directives as well as our role as a public health agency.
Bill Dries with the Daily Memphian.
Good morning. I am confused. Has the state's order on this, Governor Lee's order on this, has it done away with the local back to business plan? Or is this just certain parts of the governor's plan? Or where exactly are the local back to business standards that you outlined earlier?
So I'll make a few comments and then I'll turn over to Mayor Strickland to make a few comments as well. One, I want to note that the Back to Business Plan was a collaborative effort with many of the task force members and subcommittee members, and we developed what we thought was a very responsive and robust plan that would be data-driven at the local level. That was drafted before some of the executive orders written by the governor. And so at the current time, what we're trying to do is make sure that there's, where there should be, that there's alignment between the back to business guidance and the executive order, particularly executive order number 30 and 31 that was written by the governor. You can find the Back to Business plan on the City of Memphis website. You can Google Back to Business and it'll show up. So at the moment, please bear with all of us. We are trying to make sure that there's consistency in communication and alignment with the governor's orders as much as feasible. You may want to comment on that.
To drill it down, I think the governor's orders, for the most part, have only affected 89 counties that do not have their own health department, which Shelby County is not one of those 89, for the most part, and they have a different timeline. With respect to Shelby County, as far as I know, all he's done is preempted us on places of worship and on elective surgeries. The practical effect on elective surgeries, I don't think is there's really any difference, because our back to business plan called for elective surgeries to come back online in phase 1, and that's starting Monday, and I think that's when the governor's plan says too. So the practical difference is only churches, and the governor has not issued his guidelines or limitations on places of worship yet, but he's going to do so today, I believe. So I don't know how that differs from our plan, but I know it supersedes it.
So then what's going on with the hair and nail salons and the close contact businesses? Is there a split in the local collaboration or the local effort here?
All I know is there is discussion among some of the mayors in the county about wanting to go to the governor's plan, which has moved those establishments into phase 1. As far as standing here right now, I'm not sure any city has done that.
Jackie Massey with Fox 13.
Hello, how are y'all? I'm also going to piggyback off of Bill's question. So many of those municipalities that have announced that they're opening barbershops and salons are saying they're allowed to do this because the health department directive expires on May 4th. So does that mean that the health department will consider extending that health department directive, or they're going to let that expire? Like, do you have a comment on that? And what does that mean for Memphis? Will the salons be allowed to open and the barbershops? And my second question is about the churches. I'm hearing that the state isn't allowed to regulate how many people are allowed to be inside the churches with this whole reopening plan. So does that mean you guys are going to have to revise that too? Because right now it says 25% are allowed in phase 1.
So let's talk specifically about the health directive. We do have a health directive that Dr. Randolph has written that is due to expire. Until it's expired, it's still in effect, and we would anticipate either a rewriting of a health directive or deferring to the back to business plan or the executive order. And so I think before anybody jumps the gun, they need to wait and see what is issued by the health department. We have not given approval for nail salons or barbershops or any of the mentioned to open. And we have been a part of the Back to Business planning, and our input has been in alignment with the rest of the group. So I really encourage people to go to the Back to Business plan and adhere to the guidance that's in the Back to Business plan. And we will be issuing further statements as we get closer to our health directive expiring. In regards to churches, clearly what the governor's written, if it preempts us, then we will adhere to what the governor issues. As far as the authority and how many can be in a location and what the governor's authority is, I will not speak to that because it's a legal question. Did you want to add anything? No. Okay.
Chris Luther with WMC Action News.
Hello, everyone. Just to piggyback on the same topic everyone is bringing up here, does that mean, Ms. Haushalter, with what you just mentioned, does that mean that you anticipate not allowing salons and barbershops in the suburban areas to reopen on May 6th? And then just an overall general question about that. I would like to get the health experts' opinions on the plan and those plans to potentially open those close contact businesses on May 6th.
So just a few comments in general. That is still under discussion. That was referenced earlier by Mayor Strickland as well as implied by my comments, that we are assuring as much as we can that there's consensus and agreement across municipalities. Dr. Randolph is reviewing the executive orders written by the governor and trying as much as possible to align our guidance with both the Back to Business plan, again, which we had a significant amount of input on, as well as the executive orders. Keep in mind that we have multiple municipalities, and each municipal mayor and his council can make decisions that may be more stringent or a little bit more flexible within their own municipalities. So that's still under discussion. May 6th is a few days away, so I ask people to be patient as those deliberations continue.
Shay Arthur with WREG TV.
Hi there, hope you're having a good day. Dr. Haushalter, you've talked a lot about the importance of contact tracing in the past, and looking ahead as we start to relax these staying at home guidelines, how great is the need to have better contact tracing, and do we need more resources and funding for it?
That's a great question. Many people know that over some decades across the United States, the public health infrastructure has been defunded. That's significantly from federal dollars. And in many local communities, including Shelby County, there's always a need for additional resources around infectious diseases broadly, not limited to COVID. We do contact tracing in a variety of different areas, and Shelby County has a very heavy burden of disease relative to the rest of the state. So yes, additional resources are needed. The CARES Act has provided funding not only to the city of Memphis, but also to Shelby County. I worked with both Mayor Harris and Strickland yesterday to submit a proposal on what I believe fundamentally we need within public health to continue to do appropriate contact tracing for COVID-19 specifically. More to come on that. Both mayors are taking that proposal under consideration, but we do anticipate bringing on additional staff, particularly as our existing staff go back to their regular duties. Thank you.
We have time for one more set of follow-up questions. Final questions coming from Jacob Steimer with the Memphis Business Journal.
Yeah, thanks. Dr. McCullers, come next week for, say, going to a restaurant, my guess is you wouldn't recommend, someone who's 80 years old visiting one right now. I was kind of wondering where that bar might be in your mind. Like, should a 60-year-old be going to a restaurant in phase one, 50-year-olds? Because you said it's somewhat of an experiment, so I'd really be curious kind of your thoughts there. And then Dr. Haushalter, I was wondering if there's, besides the executive orders from the governor, I was wondering if there have been any other requests made of the Shelby County Health Department by the state health department or by Governor Lee's office that we should know about.
So my wife asked me, were we going to go out to dinner on Monday? And I told her, no, we were going to wait and go out Tuesday. So that's the start. Now, I would say one of the things we've talked about a lot during this is the ability to go out into public doesn't mean you have to go out into public. And we still recommend that all of those who are at risk because of age, and particularly over 60, it looks like is higher risk, or who have immunocompromised or are pregnant or have other health concerns, should stay inside and should continue to abide by what we've been doing with social distancing, the safer at home measures that have been so successful right now. So I would say if you have health conditions or you're 80 years old, I would not be going out into the restaurants right now. I would be staying home and protecting yourself. And in general, if you're worried about contracting this disease, you should continue to take the measures and not go out. Again, it's the option will be there. Those businesses, I'm sure, are eager to very safely and slowly in a phased manner ramp back up, but we also don't want to be transmitting this virus, and we do want to protect those who are at risk.
As far as other requests from the governor's office or the state health department, we work very closely with the Tennessee Department of Health throughout the year, and we've worked particularly close with them during COVID-19. Their requests to us have been more what resources and assistance and guidance do we need from them to be able to meet the needs of our community in Shelby County. We've not had other specific directives from the governor's office. One key area that's a focus moving forward of the state health department and the governor's office is expanded testing, which has been mentioned earlier, and particularly expanding testing into more vulnerable communities and assuring that there is equal access. I want to continue to commend our testing team and our safety net providers, because we've done an excellent job in Shelby County at reaching many, many communities, but we can expand access to testing if we get support and other resources from the Tennessee Department of Health and the governor's office. Their second priority for testing is nursing homes, and we're working with them currently to see how best to offer testing in the many nursing homes that we have in Shelby County. And I'll end there and see if Mayor Strickland want to make any ending comments. No.
No closing statements from any of the panelists. Thank you, everyone. This concludes our briefing. Please stay healthy, have a beautiful weekend, and we will see you Monday.